Assalamu alaikum, and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host, Fahad Batten, for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I pray that we all had a nice and positive week so far and looking forward for a nice and relaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 13th of February 2025. And the time just past 6 p.m. And we are casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpeth, and Bedford. It is beaming out to all our people, and definitely you can hear us on Inspire FM radio, or you can hear us on Inspire FM app, or you can view us on an Inspire FM Facebook and YouTube channels. If you're listening to the show on Thursday or any other Saturdays, that means it's recorded. But hey ho, today is not a recorded show; it's a live show. So, according to NHS, to stay healthy, adults should do 150 minutes of moderate intensive activities to keep themselves healthy and fit. And having a balanced diet do provide a vital intake in order to keep a person and human being into the optimum health. But today we will be, as we know that in 15 days time, Ramadan will be starting soon, inshallah. So as the Ramadan starts, we normally make sure our physical health and well-being being looked after properly, but not just physical health and well-being. We need to look into our health-wise. If you are suffering from long-term health conditions like diabetes, asthma, respiratory diseases, or any other long-term conditions where you are in regular intake of medications, definitely you need to get those plans in place. And that's where the interesting bits comes in play, because we are making sure that our health and our well-being being looked after while during the month of Ramadan. And definitely there are certain things, certain ways we can observe fast, and some people are exempt from observing fast. So today's show is something in that line, and without further ado, the topic of our show is diabetes and its management before and during Ramadan. Yes, you have heard me correctly. We will be talking about management of diabetes before and during Ramadan, and you will be surprised to know I won't be the one who will be speaking about this topic. I will be the one who will be posting questions about this topic. I do have a very lovely doctor as a guest who will be coming in shortly. Unfortunately, she's stuck in the traffic. So till she arrives, I'm lucky to be joining me in this to talk about this show as topic is one of our other doctor from Luton Dunstable Hospital, Dr. Nabila Anwar. She just stepped in on a very last second on a special request, asking. I did put her on a very tight spot. Says I need somebody to fill it up. So because although I do work in NHS. However, I am not medical, and we know that in this show we normally have a discussion about medical details with a clinicians. So luckily, I have joined by a doctor, Dr. Nabila Anwar, via online link. So let me welcome her. Assalamu alaikum, doctor. Are you there?
Walaikum salam.
Thank you so much for joining in on a very short notice, doctor. And
No
thank you
worries.
so much. So, tell us firstly, give a quick introduction about yourself, and tell us what is diabetes and how it affects our body. Hello, can you hear me?
Hello, sorry.
Yes. So, give us a quick introduction about yourself, doc.
I'm Nabila. I'm a junior doctor working at Luton Dunstable Hospital, currently in the obstetrics and gynecology department.
Mhm.
So I can't say my knowledge in diabetes is the best, but I'll be trying.
Definitely, definitely. So tell us, what is diabetes and how it affects our body?
So there's two different types of diabetes. One is
Hmm.
type 1, and most people that have type 1 diabetes is something that they suffer with um, from the offset from when they're born, and it's usually your body isn't producing insulin,
Hmm.
which is why the treatment for that is usually insulin injections, things like that. And then there's type 2 diabetes, which is where it's a lack of your body's response to insulin.
Hmm.
Um, so, and that can happen um, at any stage of life, really. But that's usually is one that people develop with time rather than one that they're born with.
Hmm. Okay. So is that a curable disease?
Um, it depends really what so type 1 diabetes isn't, whereas type 2, it depends at what stage they sort of
Hmm.
get it at. So if you're pre-diabetic, that that stuff is reversible.
Hmm.
Whereas if you go beyond a certain point, usually it's not really reversible, but you can keep, if you keep it managed well enough, you can prevent all the side effects and the complications that come with it.
Perfect, perfect. And on that note, I must say, let me introduce our doctor. She just arrived, and thank you so much, doctor,
No
for
worries.
thank you so much for Nabila for jumping in and supporting us
No
till.
worries.
Thank you. Assalamu alaikum.
Walaikum
Uh,
salam.
and on that note, let me introduce our second doctor, who will be, well, she's the first doctor. She's the main guest of the show. Doctor. I forgot the name. Dr. Ruba Shahid. Yes. Assalamu alaikum, doctor. How are you?
Alaikum salam. Good, thank you. Thank you so much for being so patient. I do apologize. I'm coming straight from my clinic.
Yes, I know. I did in earlier. I did say that you're running late because of the patients, and luckily I was lucky enough for another doctor who just jumped in on the very last second. So thank you for Dr. Nabila Anwar who jumped in on the last second and kind of rescued it the
Oh, thank
show.
you so much.
So as I always start in the start of the show, I always introduce my guests. So Doc, can you give a quick introduction about yourself?
So I am a GP and I'm also a GP trainer. So I do have an interest in health and well-being, and women's health and mental health. And a big part of my role is empowering individuals in sort of improving their health just through knowledge, and what's available in the community, really.
Yes, indeed, indeed, and definitely empowering people or individuals with right knowledge at the right time does help for individuals to look after their health, their well-being. Even sometimes people think that yes, this knowledge is not good, but every single knowledge is good. That's how I have learned, isn't it?
Yes, that's correct.
Okay. So coming to our topic itself, today's topic, the topic which we're discussing today is diabetes and its management before and during Ramadan. And you know yourself as well, being a doctor for how long you're a doctor for since.
Will be 10 years soon.
Mashallah, mashallah. So in last 10 years, you have seen so many
Mm.
patients, and you just like me, you have come through so many patients who do not have right knowledge and information, who jumped into things which can, instead of making themselves better, made it worse for them. So today's topic is basically in the same line, to educate and to spread necessary information to all our listeners so they can take necessary right steps towards the right direction. So on that note, the topic which we, as I said, diabetes. So a very quick insight which I've asked Dr. Nabila as well. So what is diabetes and how does it affect our body?
So with diabetes, I caught a little bit of what she said, and essentially what she said is absolutely correct.
Hmm.
Diabetes is essentially the body's inability to use fuel, which is sugar sugar in its simplest form.
Mm-hmm.
And as she pointed out, there are two types of diabetes. There's one where you have a hormone in your body that normally breaks down the sugar into a form which our body then uses as a fuel.
Mm-hmm.
So this hormone is essential. And in one type of diabetes, that hormone is just not present at all from birth.
Mm-hmm.
And these are the patients who end up on lifelong insulin.
Mm-hmm.
In the second, in the other main part, which develops later on in life and is something that we call acquired and lifestyle related to a large extent, this is where the insulin sort of loses its efficacy. So either its production starts to go down, or it's being produced, but it's just not effective.
Mm-hmm.
So it's not being able to convert the food that we eat into that form of sugar, which our body needs to use as fuel.
Mm-hmm. Right. Okay. So when we talk about diabetes and its different type, and you just clearly defined how they are different from each other. So what are the main risks when it comes for fasting for a diabetic patients? What are the main risks for those patients who are suffering with diabetes?
So for those individuals who have diabetes, the first thing that comes to mind is their sugar levels. So when you are fasting, there are prolonged periods of time when you're not eating or drinking. And I think that's quite an important emphasis I would like to make as well,
Mm-hmm.
that hydration and fluids is just as important as the correct meal time.
Mm-hmm.
So one aspect is the timings of the meals. And that can cause sugar levels to go down to they're very low, something that we call hypoglycemia. Some people can begin to feel quite unwell. You may notice some signs such as getting hunger pangs, feeling sweaty, feeling weak, feeling dizzy. In quite severe cases at the other end of the spectrum, it can produce seizures and loss of consciousness. But you can notice symptoms develop quite quickly. You'll notice some mild symptoms like even tiredness. And on the other, and similar to that, you can get high sugar levels. That's probably associated more around the meal times when you're eating and you're consuming food. And with that, some of the symptoms, especially if the sugar levels have been persistently raised, as individuals may find over a duration of time, is they may get symptoms classically involving excessive thirst, excessive urination, and they may feel tired, maybe weight loss. That's a sign that the sugar in the bodies is constantly high, and the body's not coping. So there's an overload of sugar.
Mm-hmm.
But also things like dehydration, getting sort of heartburn from mealtime. Those would be, in terms of the sugars, those would be the main ones. Yeah.
Mm-hmm. So when we talk about diabetes itself, before I move into the next question, let me introduce our listeners as well, because I'm completely forgot about my listeners. So listeners, if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text message or WhatsApp on 0779 481822. I repeat, 0779 481822. And we are discussing about diabetes and its management before and during Ramadan. So, Doc, in terms of the diabetic patient itself, when we're talking about them and their risk, how does fasting affect their blood sugar in the people with diabetes? I know you said it can go down and it can go up, and the management of those things. So, can they able to manage themselves while they're fasting, or can they do necessary steps, or what necessary steps they can do to manage those kind of symptoms?
That's a really good question. So I think for simplicity, let's break it down. First of all, starting with those individuals who have diabetes, but who are not on any medications. So these are individuals whose diabetes is diet and lifestyle controlled. Here, there is this responsibility of eating the right kinds of food, having the right portion sizes, staying hydrated, and listening to your body as well. Because even though you're not on medications and you do start to feel unwell, it is important to realize that actually maybe it's not working, and it may be unsafe to continue fasting. So these are some these are the essentials. for those who are on medications, the first thing I would say is they would need to get medical advice that are they actually fit to fast. There are a number of exemptions to fasting, and one of them is individuals who are on medication. So classically, those who are on multiple different medications, even if they're tablets, or especially insulin, I think that's even more restricted. And there are very, very, very few people who can fast who are on insulin. But understanding that with the medications, you can, with the help of your doctor, they can possibly, if your diabetes is well controlled, your medications are stable, you may be able to adjust some of your medications so that you're able to accommodate fasting. But maybe monitoring your blood sugar levels at certain points in the day, including after suhoor, midday, before iftar, after iftar, that will give you some indications. So before and after iftar will give you an indication about your diet, the food you're eating. So if the sugar level is rising quite significantly, perhaps that's an indication you're not quite having the right foods in iftar, and there's some room for improvement there. So diet, timings, listening to your body, speaking to your doctors, but even looking at website and resources like diabetes.org.uk, there'll be a lot of information out there at the moment for our community, for our members, and how to support them to have a healthy and safe Ramadan.
Exactly. And sometimes these kind of things does help a lot, because people, and I'm talking blatantly, unfortunately, about our community. So we do live in a society where when we open fast, we do not realize what we are eating and how we are eating. We end up having 3-4 dates, or going for things like samosas and pakoras and all those things which has high content of fats and sugars and definitely things which is definitely not good for body, especially after breaking a fast, because your body is in a complete no food zone, no food no drink zone for good 10 12 hours, 15, because as we are going towards the winter side, it's getting shorter, but definitely a big chunk of the day is already there fasting. You haven't got a single food or drink to eat or drink. So yes, it does help. And so in terms of the coming back onto the topic itself, the symptoms you mentioned about low blood sugar and high blood sugar, which is also called hypoglycemia and isn't it?
Low sugar is hypoglycemia, and high sugar is called hyperglycemia.
Okay. So in terms of what are the symptoms of low sugar, hyperglycemia, hypoglycemia, so what are the symptoms people see, especially for people who are not on medication? Because they're not in medication, sometimes they don't feel those kind of things on a day-to-day basis. So how do a person know that their sugar is going low or high?
So this can be a little bit tricky, actually, because as you said, they're not on medications. Maybe they'll think they're okay, they're exempt from these complications because it's only for people who are taking medications. But sometimes the symptoms can be quite subtle. They can be just the usual symptoms that you get from after a hard day's work. For example, you may feel very tired, very lethargic. It might be something as simple as that. Or going along the spectrum, you can, as I mentioned, you can get tired, you can start feeling thirsty, you can start feeling hungry, you can start feeling weak, you can start feeling dizzy, sort of stop sweating, feeling a bit, going further along the spectrum, feeling confused, drowsy. So, when you start feeling unwell, that's the time to sit down and think, is this the start of my sugars dropping? And you just have to be really sensible. Not everybody has access to a blood glucose monitor, but if you do, maybe check it. And if it is low, I would say, that's probably an indication. I mean, as a doctor, I would say that don't continue with your fast.
Definitely.
Yeah.
Definitely. Because there is an exception in our religion.
There is an exception, yes.
So in terms of high blood sugar, how do we know that it's gone high? I know during the month while you're fasting, you don't feel any highs. And if you're feeling high, that's definitely something wrong with your body.
Yeah. So that's the difficulty. So initially, I mean, with low blood sugar levels, sometimes you can a lot of times you get symptoms relatively quickly. but you may not necessarily feel high sugar levels on a day-to-day basis. It's only when that effect has accumulated, that's when you start feeling symptoms. And actually, a lot of times, that's pretty late into, it's been there for a while. But of course, even then, better late than never, you can still correct it.
Exactly.
But some of the symptoms include things like, even then you can feel quite tired. You can feel tired. You can feel like you're maybe losing weight. You can feel a bit foggy in your brained, can't really concentrate. Then you might start feeling very, very thirsty. No matter how much you drink, still feel like you need more, passing a little bit more urine. So these are the symptoms. And then reserved for certain cases, you can get sort of abdominal pain or vomiting. These are emergencies, in which case you do need to seek medical attention quite quickly.
Definitely. In terms when we are talking about the whole overall arching of the whole sections, how can people with diabetes safely manage their blood sugar level while they are fasting? So yes, when they are not fasting, if their blood sugar is going low, you can always have something sweet to eat. I know you said if they are going dangerously low, like they are fainting or they are completely gone, or they end up having in the hyper one, you have to put dextrogel underneath the tongue, which is definitely the right thing to do. But how can a person know that yes, I need to break the fast, or how can they manage their blood sugar?
So I suppose, and so the first part would be, we lose that element of eating regular meals during Ramadan. So I think that's the first thing we need to be aware of. So when you are having your meals, you need to have a close look at what you're eating. So you want to have, for example, in suhoor, you want to have what we call low glycemic index foods. These are foods that release sugar slowly and steadily throughout the day. So not anything where there's a sudden spike, sudden burst of sugar, and then there's a sudden crash. So there is a difference between the types of sugars that we're consuming. Things like white rice, white bread, potatoes, these can classically be associated with surges in blood sugar levels and then the sugar levels going down. But if you have something like oats, proteins, instead of potato, have sweet potato, these have the way the sugar is released a little bit better. So that can help support you. And sorry, you were saying you wanted to know about how you can manage it better. So one part is the diet. So you're making sure you're having the right kind of suhoor to get you through the day, especially if you're working and you've got a busy day ahead. The other thing is you will know from your body when you're feeling tired, when you're feeling unwell. I think it's important at that point to take a break, sit down and have a just check in with yourself, because as I said, if it's early, you still have time to possibly do something about it. So if you're in quite a physically exertional job, then maybe just take some time out to see if you recuperate. But if you're not, then you need to keep a low threshold.
Exactly. But take a breather in a way.
Yeah. But going to the websites which have these information will be very useful, because it will tell you what kind of things to look out for. Sometimes some people might need to take a gap in the middle.
Indeed. That is really, really interesting as well. And on that note, I must say, wow, the time has passed really, really quickly. We're about to go for a very short commercial break. So when we come back from the break, we will discuss a bit more about in terms of how we can make sure that we have the right medications in places or insulin in places, and how we can keep it safe and secure going forward into the month of Ramadan. Stay tuned. We will be back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Four matters are from amongst the Sunnah of the Prophets. 1. To have modesty. 2. To apply perfume. 3. To use a miswak. And 4. To perform marriage.
Ready to build your future? Central Bedfordshire College offers adult ESOL courses to improve your skills and achieve your goals. Learn English at any level for work, life or study. Gain confidence, communication and employability skills and access to work placements leading to jobs. Call 0345 658 8990 or email cradford@bedford.ac.uk to start your journey. Central Bedfordshire College, empowering your future.
How many times have you needed urgent medical supplies but don't know where to go? At Harris Pharmacy, we take pride in delivering a high-level healthcare to our community. This is why we have services such as private one-to-one consultation, free prescription ordering from GP and delivery to your home, mobility aids such as providing wheelchairs and many other items for everyday use. Call us today on free phone 0800 458 2850 to discuss your medical needs. We are open from 9 a.m. till 7 p.m. Monday to Friday and 9 a.m. till 4 p.m. on Saturdays. Harris Pharmacy, 165 A/B, Dunstable Road, Luton.
सूरज की किरणों से चमके सारा जहां, इंस्पायर एफएम की लहरों से महके सारा समा, रहे आपके साथ जहां और वहां, शेयर रेडियो इंस्पायर एफएम है।
Greystone Solicitors are committed to protecting your rights and fighting your corner to ensure you get the best possible results. Specialising in immigration matters, employment issues, family matters, personal injury, medical negligence, civil litigation and housing. Need help with your immigration problem? Greystone Solicitors provide free immigration drop-in clinics every Friday. Call Greystone Solicitors today on 01582 343 453 or visit us at 275 Dunstable Road, Luton, LU4 8BS and begin your journey towards justice today.
Losing a loved one, especially a mother or a father, could mean losing access to safety, education and shelter. We here at Crisis Aid believe that children in the world deserve a better chance at life. Your small donation can influence a big change. Donate today. www.crisisaid.org.uk/orphan fund or call our donations line 0333 305 5000.
Have questions about Islam? Looking for clarity and guidance? Tune in to the Ask Imam show on Inspire FM every Friday at 4 p.m.
Join Imam Waz for a full hour each week where we will dive into important Islamic topics and answer your questions live on air.
Listen, learn and engage. Tune in to Ask Imam, where knowledge meets community, every Friday at 4 p.m. only on Inspire 105.1 FM.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matan, your host for today's evening, and today we are talking about diabetes and its management during and before Ramadan with our very own Dr. Ruba Shahid from Bellhouse Medical Center. This program is broadcasting live today on 30th of February 2025 and time just past 6:30. From our very own studios of Inspire FM for our lovely people in Luton and surrounding areas of Luton like Dunstable, Harpenden and Petford. And our positive airways reaching to all our listeners who are listening us through our website, app or radio, and definitely viewing us through our Facebook and YouTube channels. Good evening and welcome back. ब्रेक पे जाने से पहले हम इंग्लिश में बात कर रहे थे. आप यही सोच रहे होंगे कि ये क्या हो गया यार, अचानक से बंदा स्विच क्यों हो गया. ये हमारे शो की एक खासियत है, अक्सर बेशतर हम 2 ज़बानें मिक्स कर देते हैं. सो वो लिसनर्स जो हमें उर्दू में सोच सकते हैं, समझ सकते हैं, उनके लिए भी हम चाहते हैं कि थोड़ा-सा इन्फॉर्मेशन मौजूद रहे. सो आज का टॉपिक है हमारा डायबिटीज़ और उसकी मैनेजमेंट रमज़ानों के दरमियान और रमज़ानों से पहले भी. और इस टॉपिक पे हम जो है वो अपने बात कर रहे थे शुरू से ही, और हमारे साथ हमारी डॉक्टर साहिबा शामिल हैं, डॉक्टर रूबा शाहिद. सो हमने उनसे शुरू पहले हाफ में भी बात की इसके बारे में कि डायबिटीज़ क्या है, किस तरीके से क्या असर डालती है, रमज़ानों में क्या मसला होता है. तो उन्हीं बातों को लेकर हम आगे चलेंगे और इस हाफ ऑफ द शो में हम बात करेंगे कि आया जो पेशेंट डायबिटिक हैं, कौन से डायबिटिक पेशेंट्स हैं जो जिनको रोज़ा रखना चाहिए और नहीं रखना चाहिए, और उनकी मेडिकेशंस किस तरह मैनेज होती हैं. अगर कोई खुदा ना खास्ता इमरजेंसी आ जाए तो किस तरह करते हैं, और कब हमें लगता है कि हाँ यार हमें रोज़ा तोड़ देना चाहिए. ये सारी बातें और बिट मोर इंशाल्लाह हम इस हाफ ऑफ द शो में बात करेंगे. सो लेट मी इंट्रोड्यूस बैक आवर डॉक्टर रूबा शाहिद. अस्सलाम वालेकुम.
अस्सलाम.
क्या हाल है आपके?
अल्हम्दुलिल्लाह ठीक ठाक.
अच्छा. सो डॉक्टर साहब, थैंक यू सो मच फॉर कमिंग इन टुडे फर्स्ट ऑफ ऑल. सो आप हम जैसे हमने पहले हाफ में हमने बात की, आप ज़रा हमें बताएंगे कि डायबिटिक पेशेंट्स के लिए क्या रोज़ा रखना सेफ है, और कौन से ऐसे पेशेंट्स हैं जो डायबिटिक हैं जिनको रोज़ा नहीं रखना चाहिए?
तो काफ़ी लोग हैं डायबिटीज़ के मरीज़ जो रोज़ा रख सकते हैं. वो ज़्यादातर वो वाले मरीज़ होंगे जो जैसे दवा पे नहीं है. उनको बस अपना खाने-पीने पर काफ़ी एहतियाती बरतनी है. मील टाइम उनको प्रिपेयर करना है ताकि उनका शुगर ज़्यादा ऊपर-नीचे ना हो. जो दवा पर हैं, आई थिंक उनको थोड़ा केयरफुल रहना है. शायद अपने डॉक्टर से भी बात कर लें, क्योंकि ये डिपेंड होता है कि एक तो वो कितनी दवा ले रहे हैं. दूसरी कौन-सी तरह की दवा ले रहे हैं. क्योंकि कुछ दवाइयाँ ऐसी होती हैं जिनका साइड इफ़ेक्ट होता है कि डिहाइड्रेशन, पानी की कमी से या खाना ना खाने से, टाइम पे खाने से उनका शुगर ड्रॉप ज़रूर होगा. तो इस तरह से ये जानकारी भी काफ़ी ज़रूरी है.
एग्ज़ैक्टली.
जो इंसुलिन पर हैं, उनके लिए काफ़ी मुश्किल है. आई थिंक बहुत कम लोग हैं जो इंसुलिन पे हैं और वो रोज़ा रख सकते हैं. उसके लिए तो किसी स्पेशलिस्ट नर्स या अपने कंसल्टेंट से बात करनी होगी.
ठीक है.
जनरली स्पीकिंग ये एम्फेसिस करना ज़रूरी है कि रोज़ा जो है उन लोगों के लिए है जिनकी सेहत उनको इजाज़त देती है रोज़ा रखने के लिए. अगर आप बहुत सारी दवाइयों पे हैं, अगर आपको कॉम्प्लिकेशंस बताया गया है डायबिटीज़ के हैं, उनको नहीं रखना चाहिए. अगर आपको पता है आपकी शुगर बहुत आसानी से बिगड़ जाती है, उनको भी नहीं रखना चाहिए. जो इंसुलिन भी बहुत तरह के होते हैं. कुछ कम वक़्त के लिए काम करते हैं, कुछ लंबे वक़्त के लिए काम करते हैं. कुछ लोग जो हैं दोनों तरह की इंसुलिन पर होते हैं, उनको भी रोज़ा नहीं रखना चाहिए. जो प्रेग्नेंट लेडीज़ हैं, उनको नहीं रखना चाहिए. वो भी जो अगर उनको जैसे जेस्टेशनल डायबिटीज़ एक होती है जो सिर्फ़ प्रेगनेंसी में होती है, उनको भी रोज़ा नहीं रखना चाहिए. जो बुज़ुर्ग लोग हैं, अगर वो दवा पर नहीं है, तो एक तरह से वो भी शायद एग्ज़म्प्ट हैं, क्योंकि उनकी बॉडी जिस तरह से शुगर को हैंडल करती है, वो वैसी नहीं होगी जैसे जो यंगर और थोड़े फिटर लोग हैं, वो कर पाएँगे. तो काफ़ी इस तरह से डायबिटीज़ के अंदर जो है कैटेगरीज़ हैं, और कुछ रख सकते हैं, कुछ नहीं रख सकते हैं.
सही. And you were absolutely correct on that. कि इस बाज़ औक़ात क्या होता है कि हमें खुद अंदाज़ा नहीं होता है कि यार हम क्या रखा जाए या नहीं रखा जाए. तो जैसे कि अभी मैंने शुरू में मैंने बोला कि अभी रमज़ान शुरू होने में 2 हफ़्ता बाकी है. तो अगर कोई पेशेंट जो हमारे बहुत सारे लिसनर्स हैं, उनमें जो भी सुन रहे हैं या देख रहे हैं, अगर वो रखना चाहते हैं और वो डायबिटिक पेशेंट्स हैं, तो क्या वो अपनी जीपी से फ़ौरन मशवरा लें कि भाई किस तरीके से एक रखा जाए या क्या तरतीब रखी जाए मेडिकेशंस की और दूसरी सारी चीज़ों की?
जी, बिल्कुल. अगर आप श्योर नहीं हैं, थोड़ा-सा भी आपको डाउट है, तो प्लीज़ आप कॉन्टैक्ट करें. ये जैसे मैंने बिल्कुल शुरू में कहा था, नॉलेज होना बहुत ज़रूरी है. और आपके जीपी, आपकी कम्युनिटी में जो डॉक्टर्स हैं, वो आपकी मदद ज़रूर करेंगे. आप अपॉइंटमेंट GP के साथ बना सकते हैं, नर्स के साथ बना सकते हैं, बहुत सारे जैसे डायबिटीज़ ऑर्गेनाइजेशंस है, अगर चाहे उनसे भी कांटेक्ट कर सकते हैं, उनके पास भी बहुत सारी इन्फॉर्मेशन है। आपके जो फार्मासिस्ट है उनमें भी बहुत नॉलेज है, वो भी आपको काफ़ी हद तक इन्फॉर्मेशन बता सकते हैं। तो इस तरह से बहुत सारे रिसोर्सेज कम्युनिटी में हैं। लेकिन ज़रूरी बात ये है कि अगर आप श्योर नहीं हैं तो प्लीज़ आप पूछें।
Correct. Perfect. So, in terms of the insulin, you mentioned insulin quite a few times. So, I just want to come back on that particular point. So, can diabetic patients who take insulin while fasting, because you said that there's only a handful of patients who are on insulin and they are diabetic, can fast. So, is there a way for patients who are on insulin can take insulin while they're fasting, or not, or they have to make sure that they're managing their insulin intake during the timings? Because alhamdulillah, we are going towards the winter side where the days are shorter. Days will be like 10 hours fast or 6 hours, 7 hours fasting. So, will that be more suitable for those people?
So the first thing to say is you do not want to compromise your diabetes control for the sake of fasting. Your diabetes, the fasting should be conditional to your diabetes being well controlled. And you can't have insulin whilst you're fasting. So the insulin has to be taken during the hours when we can eat and drink. And that's what makes it so challenging. And that's why there's only a very, very, very small fraction of people who can fast. Generally speaking, I would say no, you can't fast unless you've had clearance and very clear instructions from the consultant or the nurse specialist who is managing your insulin, your diabetes. But generally speaking, most people will find they may not be able to do it.
Okay.
But you have to get specialist advice for that.
Perfect. Okay. So when it comes to medications, are there any alternative treatments for diabetes that can help a person during fast or during while they're fasting?
I think the best example I can think of that is for those individuals who are on tablets. There are lots of different types of diabetes medications. Some are better than others in terms of maybe the side effect profiles or how and when they're taken, and they may be more compatible with fasting. For that, you would need to have a consultation because there's a reason why you're on one tablet and not another. But in exceptional circumstances, there may be a possibility to review the different medications you're on, and in the context of how well controlled if your diabetes has been well controlled, and you've had the discussion about possible changes that could be made, maybe, but that will be again a small fragment of people, and otherwise, for others, you can review whether you can stay on the same medications and maybe just amend how you're taking them. So something like taking 1/3 in suhoor and then 2/3 at iftar time. So there are ways, but you have to get medical input for that. Don't try doing it yourself, please.
Definitely. And that's what I always advise. Go and have a word with your GP. And that's one of the reasons, यही हमारी मेन वजह है कि ये टॉपिक को हम रमजान से 15 दिन पहले डिस्कस करें, ना कि रमजान के पहले रमजान को डिस्कस करें कि यार ये है, क्योंकि we being Muslim, ये अल्हम्दुलिल्लाह रमजान में रोजा रखना, और रोजा जो है एक ऐसी इबादत है कि जो इंसान की अपने लिए है, यानी अल्लाह ताला के लिए तो इंसान तो रोजा रखता है, ज़ाहिर सी बात है अल्लाह को खुश करने के लिए, लेकिन ये एक वाहिद इबादत है जो इंसान खुद, क्योंकि nobody, you cannot show that you are fasting, nobody know that you are really fasting unless you say it loudly and clearly, because you're keeping yourself off, so nobody see that yes, you are fasting or not, you are fasting. So that is one of the very things, and that's why it makes it very unique. So if you are fasting and if you have suffering from a long-term conditions like diabetes, it is definitely go and have a word with your GP, go and have a word with the imam, because they both can able to guide you what you should do and what you should not do, isn't it?
That's correct. Yeah. So having sort of the joint, as you said, the imam and your the scholar, the religious leader that you follow, and your GP can work in tandem to perhaps even find a way where you can fast and without compromising your diabetes.
Exactly.
That's possible.
And there are mosques, there are a masjid, alhamdulillah, in Luton, where necessary education for diabetes in the month of Ramadan is being given as we speak, in Jummahs, in Jummah prayers or after Jummah days. And so please do get that advice from your GP as well as your इमाम, क्योंकि आप एक चीज, क्योंकि कई दफा दीन में जो है वो दीन में आसानी है हमारे दीन में अल्हम्दुलिल्लाह. Being a Muslim, one of the beautiful thing about our religion is that there are easiness in our religion कि आप आराम से चीज adopt करें. Everything is there for you, so it's not hardship in our religion. Yes. So on that note, I must say, wow, let me introduce our listeners as well. So listeners, if you have any questions or queries regarding our topic today, which is diabetes and its management before and during the month of Ramadan, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. So, Doc, in terms of diabetes, what should a diabetic patient do if they are experiencing a medical emergency while they're fasting? So, a diabetic patient who is having a normal fast since last 2 days, exactly the same scenario which you have defined in the beginning of the show. So, what should a person do when they are facing a medical emergency while they're fasting?
So, if they're having a medical emergency, automatically that takes precedence over their fast. The medical emergency means they can't continue fasting. So depending on what the medical emergency is, if we take, for example, that you are having dangerously low sugar levels, generally speaking, in broad terms, if we take the cutoff of the blood sugar being 4, if your blood sugar falls below 4, especially if you're feeling unwell, you have to break your fast. You have to take something sweet straight away. You need to bring your blood sugar levels up because below 4 is very dangerous. And you need to follow it up with a meal. So a lot of people, what they might do is, my concern is that when there's an emergency, they'll try to take the minimal steps necessary to make sure they're safe. But you know what? If you're in an emergency, go all the way to make yourself feel safe. So in the instance of hypoglycemia, which is low sugar, as I mentioned, if your sugar is falling below 4, you need to take something sweet. And then you need to recheck your sugar levels to make sure they're coming up. If they're not coming up, you need to keep having something with an attempt to bring it up. And when it does come up, you need to follow it up with a proper meal. So don't wait until iftar and say, well, I'm going to have a proper meal. We're all going to have a proper meal then. Let me just wait till then. There is a proper way to manage it. You should be having, you can get some information like from your practice or from the diabetes website about what to do when you have medical emergencies. This information is useful to have at hand. Maybe stick it in your fridge so it's always there in sight when you need it, because when you need it, you want it to be, available for you there and then. But the important thing is when there's a medical emergency, your fast automatically assumes second place. Your health you have to break your fast and give the attention your health needs at that point.
Exactly. And that's what the beauty is. That's what our religion says as well. That if your body is not feeling well, if you during the time of fast, if you for some bizarre reason you are not feeling well, you are feeling sick, or you're feeling unwell, seriously unwell, just you have to break fast, because that's part of our deen. So in terms of you mentioned about, because one of the things people don't realize, everybody says high blood sugar is very dangerous, very not bad, not good, this, that, another. People do not take low blood sugar in count. However, low blood sugar is as dangerous as high blood pressure. If I'm not, please rectify me, Doc.
You are absolutely right. Absolutely right. There is so much emphasis on high blood sugar levels. You're right. And you know what? I would actually even take that a step further and say low blood sugar levels in some respects can be even more dangerous.
Indeed.
Because it can be insidious, and also because it can be very sudden, and the consequences can be just as dire. So perhaps this is a good point you've raised. We need to raise the awareness of low blood sugar levels, what it looks like, when it happens, what should you do. And especially now in the time of Ramadan, I think this is a very good time to just, find out more about this, because it's equally, and in some cases, I said, maybe even more dangerous than high blood sugar level, especially in the immediate phase.
Yeah, exactly. And that's one of the main reason for me to do a show like this just before Ramadan,
That's
because
brilliant. Yeah.
people, yes, they are very engaged in terms of, oh, our blood sugar is hitting 8, 9. No, we need to bring it down. We need to bring, yes, you need to bring it down. You need to keep it in that bracket of 5 and 7. That's a perfect line. Sometimes going up till 10 is okay. However, if it drops for below 4, it's even worse, because yes, you may end up going into a hypershock, and that will be even worse in certain cases. Because yes, I've seen, working in NHS, you end up seeing cases in those lines. But anyhow, so coming back to our topic itself, you mentioned about food, and you can necessarily use certain diets to control your diabetic, or patients who are pre-diabetic, to keep the body going on. So what type of food are best for diabetic patients during sahur, pre-dawn meal, and are in iftar, or in their late lunchtime meals?
So in sahur, you want to have foods which will sustain you throughout the day, and the way they're going to do that is release the energy or the sugars slow and steady. Instead of having like huge leaps and crashes in the blood sugar levels. So things like, if we take foods as an example, it's a staple in the South Asian diet is things like bread, rice, potato. So if you're going to have something like bread, whole grain bread is much better.
And you're not adding any samosas and pakoras in that line?
No, not yet. No, not yet. So so you want to have whole grain bread. In rice, brown rice is probably a bit better. Try to have more seasonal vegetables. Like potato is very high in sugar, but have more greens, more lentils. Try to include pulses and nuts. Oats is a very good option. Quinoa is a very good option. It's very protein rich. So you want to have a diet which is rich in protein. So if in breakfast, I say breakfast, in sahur, if you have something oat based or what you call low glycemic index sugars, they are the best options for you. When you come to iftar, you want something that's nourishing because your body's been in a state of fasting all day. So having fluids is, when I say fluids, I mean water.
Exactly. Not Coke.
Not Coke. No, not Coke. Not these sugary drinks. And even be cautious with your tea. I know we love our tea and coffee, but it can be dehydrating. So if you're going to have it, you need to be quite cautious, not having like multiple cups throughout the, up until sahur time. But have fluids, have water, which has cucumbers and lemons, and it was quite hydrating as well. Try to have some seeds like chia seeds. They absorb water and release them slowly in your body. They're very healthy. Have yogurts. Things like Greek yogurts are very hydrating, rich in protein. And sticking to protein, things like eggs, lentils, beans, pulses. These are excellent sources and very good to incorporate, especially during the month of Ramadan in iftar. But having a balanced diet, and if you resort to something called the South Asian Eat Well plate, this is a really good photographic illustration. It's a plate, and it shows you all the foods you should have, how much you should have, and literally in proportion to each other and the size of your plate. So that's a visual representation of what you should be eating. So I would really encourage the listeners to have a look and when they're planning their meals.
Yes, indeed. And definitely these are the things which we make sure that it is there in our daily meal, breakfast and sahur and iftar. Definitely. Yeah. And well, unfortunately, we being Asians,
yes, the fried food. How can I forget that? I think that's so important to address. I mean, all I can say is I completely appreciate people wait all year to have this. Try to be a bit sensible. You're going to have this in Eid. If you're going to exercise any restrictions, you're more likely to do it during the month of Ramadan and less likely to do it during Eid. So keeping that in mind, you can try adopting measures like having smaller portions. You can have a samosa, don't have a big samosa, have a smaller samosa. Instead of deep frying it, maybe use it in an air fryer or an oven so that there's less oil involved. maybe reserve it till after dinner. I know there's a tendency you have iftar first and then you have your dinner, but actually what happens is you fill your stomach with all these fried fatty foods, and then the healthy part gets left to later, and then you don't really have much appetite. So maybe you could reverse the order. Have your healthy dinner first and reserve all this fun food iftar for later, so you're more likely to have it in moderate quantities because your stomach is full with the healthier foods. So simple techniques, simple tips can be incorporated to try and minimize overeating these foods, because then you'll just end up with heartburn and all other problems in the long run as well.
Exactly. And definitely the best thing, well, for me personally, during the month of Ramadan is that I normally eat, the way I break my fast is to have a couple of dates and then have about a big bowl full of chopped fruits.
Oh, okay, yeah.
So without having any added sugar or anything else.
You're one of the good ones.
Well, that's just for the month of Ramadan.
Oh, okay. Very honest.
So that's my special ritual during the month of Ramadan.
Yeah.
So that I always have a bowl of fruit bowl, chopped fruits.
But a big part of Ramadan as well is it's a conscious effort to evaluate and improve every aspect of our life, especially diet. So if you do something long enough, it becomes like habit, and it will become easier to maintain that habit after Ramadan because you've been doing it consistently for 30 days. So I would say, if you've been planning on making these dietary changes, which have looked really difficult, now's your time. Do them and give it your best shot in sticking to them. And you'll be surprised at how much of that you will maintain after Ramadan.
Inshallah. And on that note, wow, the time has passed really, really quickly. We just have a couple of minutes before the end of the show. So can we do a quick round of catch up in terms of diabetes during how to manage our diabetes during and before Ramadan? So firstly, what is the best thing to do during when you're a diabetic patient, how you look after your health, well-being and diabetes, and what are the best tips, and definitely the positive message.
Okay, so the first thing about diabetes is, please, you've got 2 weeks, please take this time to gain the knowledge that you need. If you need to speak to your GP, if you need to speak to a healthcare professional, please do start making arrangements to make that appointment. Please resort to the websites about what you can and what you should and shouldn't be doing in diabetes, essentially. What's your second question?
What are the food intakes we should take, and how we can manage our diabetes?
So with food, as I mentioned, try to cut down on unhealthy foods where you can. We discussed some practical tips about how to incorporate healthier ways of having unhealthy foods if you really can't cut them out. But having proteins, having foods with low glycemic index, having yogurts, plenty of fluids, staying hydrated, meal prepping, meal planning is essential. And trying to maintain those habits that you are picking up throughout the month of Ramadan.
And positive message.
And positive message is, if you do this, inshallah, not only will your ibadah be successful, but you will feel so good in yourself.
Indeed. And that's what it is all about. Ramadan is all about making our life better and pray in front of Allah to have our akhirat better as well. So that's all we can do. We can make necessary small steps and make our life better now and akhirat better later on. Thank you so much, Ruba, for joining us today.
Thank you for having me.
And sharing best knowledges with us.
My pleasure.
And inshallah, next time we will be having a little different topic together on that note. So that's all for today's show, guys. If you missed any part of the show, you can always catch that back on our YouTube channel and on Facebook channels, or you can listen to our repeat shows. Until next week, we will be back again with a new topic, with a new timing. Assalamu alaikum.